I'm delighted to introduce our next speaker, Admiral Rachel Levine, the U.S. Assistant Secretary for Health at the Department of Health and Human Services. Admiral Levine will share her vision for improving the nation's health and well-being and how we in the ECHO community can play a role in helping to advance that vision. Admiral Levine has been a tremendous supporter of ECHO even before joining the federal government during her time at Penn State and in the Pennsylvania state government. Yeah, give it up for Penn State there. We're very grateful she can be with us through the power of technology today. Please welcome Admiral Levine.
Well, thank you very much. And I am delighted to be able to join you, at least virtually. I wish I could be there in Albuquerque. As you mentioned, I have been such a big supporter of Project ECHO since my time in Pennsylvania when I was the Physician General and then the Secretary of Health of Pennsylvania, and had the opportunity to talk with Dr. Arora, the director and founder of Project ECHO, and to learn about its amazing capabilities. In fact, we worked with the Penn State College of Medicine, which obtained a federal grant to use Project ECHO to address the opioid crisis and the overdose crisis in Pennsylvania. I've had the great opportunity to come to Albuquerque and the University of New Mexico to meet with Dr. Arora and his staff, and have met him again here in Washington. And so I am the biggest Project ECHO fan that you're going to find. So I'm really thrilled to be here today to be able to talk about the importance of Project ECHO and how it is critical in terms of dealing with the public health issues that we're addressing now at the Department of Health and Human Services. Healthy People 2030 is in my portfolio, and Healthy People 2030 defines health equity as the attainment of the highest levels of health for all people. And I have said many times that we have not made true progress unless we have all made progress. Achieving health equity requires valuing everyone equally, but with focused and ongoing societal efforts to address avoidable inequalities, historical and contemporary injustices, and the social determinants of health, and to eliminate disparities in health and health care. So everything we do under Secretary Javier Becerra at HHS, and everything we do in my office of the Assistant Secretary for Health emphasizes health equity. OASH is leading key HHS policy initiatives and working across government as a convener and an expert consultant to advance health equity in its programs. As you know, the social determinants of health are the conditions and the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health functioning, quality of life outcomes, and issues. These non-medical factors have a significant influence on one's health and well-being, and they uniquely impact all of my priority areas, and they're really perfectly situated for Project ECHO to be able to in its learning collaborative, to be able to expand education about the social determinants of health. So we're going to focus today on two specific issues that we're addressing at OASH, the Office of the Assistant Secretary for Health, and HHS, and those are climate change and environmental justice and long COVID. I am very proud to oversee the HHS Office of Climate Change and Health Equity and its sister office of Environmental Justice. These offices provide leadership across HHS and really across the departments in the federal government on these issues. And we work with partners across the administration and stakeholders in the community to advance environmental justice and climate justice with that health equity lens. Today, we are working to mobilize all HHS agencies to make certain that communities at highest risk of climate-related and environmental harm have funding and supports to work to counteract those stresses, especially as they impact health. For years, studies have demonstrated that low-income communities, communities of color, tribal nations, and other vulnerable populations, such as children, are disproportionately burdened by environmental and climate change-related hazards. These populations are more likely to be exposed to unhealthy land uses, poor air quality and water quality, dilapidated housing, lead exposure, and other environmental threats that drive health disparities. So today, I am announcing the launch of a nationwide HHS Environmental Justice Community Innovator Challenge. A nationwide HHS Environmental Justice Community Innovator Challenge to support disadvantaged communities and tribes facing the brunt of environmental injustices, including the harms due to climate change. This challenge aims to uplift community-level solutions to address these inequities with prizes totaling $1 million that will be awarded in 2 phases. In alignment with the new Executive Order 14096, revitalizing our nation's commitment to environmental justice for all, the challenge supports community-driven projects designed to address environmental justice and public health issues in areas adversely affected by environmental pollutions and hazards. The marginalized communities, such as racial and ethnic minority populations that disproportionately impacted by environmental and climate change-related hazards that contribute to these health disparities in conjunction with social inequalities. The challenge mechanism provides an opportunity for community and tribal voices to share their own approaches in improving public health, reducing pollution, and addressing local climate change impacts on our health. Our goal is to support and to learn from these partners across the country. Awards will help to engage local problem solvers on impactful community solutions. We are also working to ensure healthcare facilities will be able to operate and care for the most vulnerable communities when faced with climate-related catastrophes. In addition, dealing with the health sector, including hospitals, health systems, suppliers, pharmaceutical companies, and others, to take responsibility for their own contributions to climate change by reducing their environmental impact. On health sector emissions reductions, we have reopened the White House HHS Health Sector Climate Pledge. This already has 115 organizations committed to cutting their greenhouse gas emissions by 50% by 2030 and achieving net zero emissions by 2050. These organizations are working to build resiliency to the impacts of climate change and ensure that our health systems keep their doors open in the face of extreme weather events that are stoked by and exacerbated by climate change. Another important tool that we are working on is our Climate and Health Outlook, a monthly product that examines how climate hazards like extreme heat threaten our health and explain how we can stay safe and healthy. I would also like to highlight our department-wide commitment to addressing discriminatory environmental and health impacts through promotion and enforcement of our nation's civil rights laws. Our team is promoting tools that help government leaders and communities better identify the cumulative impacts of environmental burden and social vulnerability, including the CDC ATSDR Environmental Justice Index. So I see the future of public health as embracing these challenges, looking at the intersections of these challenges and developing solutions that benefit our nation, our planet, and all of our health, both now and for future generations. And I see Project ECHO as a key component of this in terms of educating physicians and other community members about these very important issues. The second topic I'd like to emphasize is that of long COVID. Of course, in May of this year, the public health emergency for COVID-19 ended because we are past the acute phase of a response to the COVID-19 pandemic, and we are in a better place in our response than we were 3 years ago. We have tools, we have testing, we have vaccines, and we have treatments in order to better manage the virus in the United States. However, we are dealing with the longer term impacts of COVID-19, including that of long COVID. The impacts of long COVID on the health of our nation continues. Millions of adults and children continue to experience these new or reoccurring sets of symptoms or conditions for weeks, months, or even years after infection, and we have termed this quote unquote long COVID. Now, infection-associated chronic illness is not new. There is substantial ongoing research on infection-associated chronic conditions and other diseases that might have an infectious origin, including myalgic encephalitis and chronic fatigue syndrome, or ME/CFS, and including dysautonomia. In fact, you know, in terms of the pandemic of 1918 with influenza, there was a longer term impact from that pandemic as well. So it's very important to achieve a deeper understanding of long COVID. And we believe that we can use the commonalities experienced by patients with long COVID and these other conditions to support advancement in research, diagnostic, and treatments, not only for people with long COVID, but also for people who have experienced similar infection-associated chronic illness and have faced an uphill battle for years. So last year, President Biden called upon HHS to coordinate the response to long COVID across HHS and really across the administration. So earlier this year, we announced the formation of our Office of Long COVID Research and Practice. And this is in my portfolio as the Assistant Secretary for Health. And this is to lead long COVID response and to coordinate the response across HHS and the federal government. So this office will enhance efforts being taken across the government to improve the lives of those who continue to experience the long-term impacts of the worst public health crisis that we have seen in a century. We are bringing together the resources and expertise of federal, state, and local partners, patients, providers, researchers, clinicians, and the business sector to answer the American people's call for urgent action on this issue. Outside of HHS, there is a broader government-wide response to advance progress in prevention, detection, diagnosis, treatment, and the provision of supports and services for long COVID and its associated conditions. Our driving focus is to ensure that people can recognize when they may have long COVID, when they have symptoms, and to help them to get the care, the supports, and the services that they need. And this work requires partnership. This partnerships like the monthly Project ECHO webinar series, Long COVID and Fatiguing Illness Recover program. This is a collaboration between Family Health Centers of San Diego, University of Washington, and the University of Colorado, and the CDC. And it's a Project ECHO series, which has proved critical in helping us address gaps in provider education. These monthly seminars on emerging best practices and model of care are an important tool in filling knowledge gaps, fostering collaboration, and identifying best practices. Emerging research continues to inform the way that we think about and treat long COVID and its associated conditions. This includes research such as the Recover Project at the NIH and other research at the CDC, the VA, and in many academic institutions across the country. And we want to use that research in terms of informing how we approach long COVID. And we want to, of course, continue to listen and continue to learn from patients, those with lived experience, their caregivers, their families, as well as frontline workers. And to accelerate understanding and breakthroughs, we need to continue to work together. So we need to continue to learn more through our research to have better diagnostics and to have better treatments for long COVID, and draw upon the collective experience of healthcare providers. And this is critical in ensuring that patients receive the care and support that they need. This needs to go beyond the federal government. It includes all levels of government, state, local, federal, international, as well as academic medicine, industry, clinicians, advocates, and everyday citizens. We have prioritized development of resources to improve the quality of care for people with long COVID and their families and those disproportionately impacted by the pandemic. And this requires this multi-sector approach. So please continue to commit yourself and your work to improving the understanding of long COVID and its associated conditions through education and commitment to public health. In closing, Despite the heavy toll that it has exacted, COVID-19 and the challenges of the last 3 years have reminded us of a fundamental truth, that we truly need each other, that our happiness and our very survival depend upon our connections to one another and to our community. And it is that spirit of community which makes our country great. And it's what we now need now more than ever. We know that there are many groups that face unique and increased risks. We must work to close disparities in access and outcome, eliminate bias and discrimination, and address the systemic barriers, including racism, that have contributed to historic inequities. All Americans deserve care and services that are timely, affordable, accessible, equitable, and high quality. These are our family members, our friends, our neighbors, our students, and coworkers. As a nation, we can do better. We must do better. And with your help and with fantastic programs like Project ECHO, we will do better. So thank you so much for having me here today. If possible, through this program, I'm very pleased to answer any questions.
Thank you, Admiral Levine. Thank you for your leadership, your inspiration, and for challenging us all to do more in the areas of health equity, climate justice, and long COVID. Thank you so much.